Today we're talking about the impact of the pandemic on our mental health. We have Dr. David Spiegel with us with Stanford Health Care. Thank you so much for joining us.
You're welcome.
So tell us about how big of a problem this is. I mean, we are now more than 2 years from the beginning of the pandemic, and it's really weighing down on a lot of people.
Well, it sure is, Amanda. We're, for a whole host of reasons. So, part of it is what the pandemic is doing to us, and part of it is what the pandemic is keeping us from doing to make ourselves feel better. And so what it's doing is instilling us with fear about the world around us. We've sort of retreated into our cubby holes here, and there have been some advantages, less commuting, maybe more efficiency, maybe better opportunities to exercise, closer ties to one's family, actually. I mean, some families have reported they're happier, that they are interacting more with one another, which is a good thing. But the bad thing is we're afraid of what's out there. We're afraid that any social contact could make us sick. And earlier in the pandemic, pre-vaccination, that it could kill us. We've lost almost 1 million Americans. But the things that we usually resort to feel better about ourselves, like having social contact with others, are the things now that we are most interfered with, and that's a real problem.
Okay. And more students say they experienced racism recently. Does discrimination pose more of a threat now than before the pandemic? How has that played a role here?
Well, look, stress doesn't always make us better people. And one of the terrible human tendencies is to blame other people for your problems. We call it scapegoating. You see it a lot about immigrants. You see a lot about people who are different from us in some way. The United States did it to the Japanese in World War II. The Russians are horrifyingly doing it to the Ukrainians. So the problem is clearly in Russia, and they're pretending that they're making the problem in Ukraine. So there is a tendency to use the old racial fault lines as an excuse to vent your unhappiness with yourself or with your life on somebody else. So yes, unfortunately, there have been more reports of various kinds of racism, and it's unacceptable in any circumstance. And it's worse now when we really need to stick together, when one of the few things that could be comforting is feeling you live in a sense of community with people who care about you and you because you care about them.
And how would you recommend people could combat those feelings? It's obviously a huge topic to tackle.
Sure.
So how do you even approach it?
We have a program at Stanford about seeing violence or potential for sexual assault. Don't be a bystander, be an upstander. So what really helps in every case is if you see something going on that troubles you, don't pick a fight about it, but state your case and try and make something better about it. Say something nice to the person who's being criticized or attacked inappropriately. Just state your ground, but state it in the terms of trying to set a different norm of behavior and building community, not fracturing it.
Okay, and switching gears a little bit, did the pandemic affect the mental health of youth more than adults, or was it vice versa?
No, actually, that's a very interesting thing, that it turns out in studies that we've done and many other people have done, that the highest rates of anxiety and depression and the biggest increase are among people aged 15 to 30. Now, you'd think since us older folks are at higher risk of dying from COVID, that we'd be the ones that would be most stressed. But it turns out that we're on the low end of that. And I think the reason is this. What is your task in life when you're an 18-year-old? It's to separate gently as you can from your family of origin and build a new family of orientation. Make friends. Form relationships, become involved with other people, build your own family. And that is the thing that has been most interfered with by the pandemic. It's been difficult, in fact, sometimes dangerous, to go out and meet strangers and form new relationships. So it has interfered the most with the phase of life that young teenagers and young adults are in, and they have suffered the most. So their rates of anxiety and depression have doubled. And thoughts about suicide have increased too. The only good news in this bleak picture is that the actual numbers of suicides have decreased a bit. They have not increased, I'm glad to say.
That is good to see. So how much of a role does mental health play when it comes to those high-risk behaviors? We're talking about alcohol use, drug use. I mean, when you're feeling down, it's really easy to access one of those things to help.
Yeah, and some mental alterations, done in moderation, can give you some relief, but it's too easy, especially when there isn't much else to do, and you've got the drugs at home, to just keep taking more of it and get yourself dependent or do other kinds of harm as a result of intoxication. And so, I think what I would advise people to do is take care of themselves the way you would take care of a child or a pet. Think of your body as a creature that depends on you for health, and do the things that makes your body healthy. So eat well, sleep well, get plenty of sleep, 7 to 8 hours of sleep a night. Get exercise every day, and don't poison your body with tobacco, with too much alcohol, with other drugs that can do it harm. But if you think about the way you relate to your body, doing the right thing becomes a lot more natural.
Got it. So for parents and students, how do you start to heal all these mental scars that may have developed in the past couple of years?
Well, it depends on how serious the scars are, but I would say, just for starters, just acknowledging it and talking about it. There's no reason why we shouldn't feel bad about the things that have so profoundly interfered with our lives. And just talking about it kind of normalizes it and gives you a bit of perspective, a little bit of distance. Writing about it. There are studies that show that journaling actually helps give people relief. You can see things in perspective. You hear how the other person is dealing with it. If you're finding that your days and nights are really interfered with anxiety, your motor running, you can't turn it off, or with depression, feeling hopeless, helpless, and worthless, if you're having thoughts of harming yourself, get professional help. There's plenty of good mental health care available, not as much as we need, but a lot. And so see your doctor, a psychiatrist, a psychologist, a counselor, and admit to yourself that you need help and get it. It really does make a difference.
All right. Well, Dr. David Spiegel, Stanford Health Care, thanks for discussing this very serious topic.
You're most welcome.